Good afternoon all. My topic for presentation is comparison of efficacy between innovator ranibizumab, aflibercept and biosimilar ranibizumab in patients with wet age-related macular degeneration. So age-related macular degeneration is the leading cause of irreversible central vision loss in older individuals. Presence of choroidal neovascularization defines the wet ARMD. Here a protein called VEGF makes abnormal proliferation of the choriocapillaries, which will break through the Bruch membrane and reach the sub-RPE and subretinal space. So, since the pathogenesis is because of VEGF, the treatment of choice is anti-VEGF injection. In this study, we compare two anti-VEGF drugs. First one is ranibizumab, which inhibits VEGF-A only. Second one is aflibercept, which inhibits VEGF-A, B, and placental growth factor. In ranibizumab, we are comparing two groups, innovator, that is X-Hendrix, and biosimilar, that is Trastuzumab. So what's a biosimilar and why we need a biosimilar? A biosimilar is a copy of innovator drug, but large in size and complex, with similar chemical characteristic, efficacy, and safety. Biosimilar manufacturing is not as complex as that of innovator, so it's comparatively cheaper than innovator drugs. So what are the concerns with innovator drugs? First one is cost. As I told, it's costlier than the biosimilar agents. Then availability. As we know, anti-VEGF is also useful in other common conditions like diabetic edema and all. It's always better to keep some alternative drugs to increase the availability of the drugs. So what's the concern with biosimilar agent? It's the safety. When Trastuzumab was introduced initially in the market, there were many cases of increased inflammation were reported. So safety is an important factor in concern with the biosimilar agent. Coming to my aim, it's compare efficacy between innovator ranibizumab, biosimilar ranibizumab, and aflibercept in wet ARMD. Study methodology, it's a prospective single-center observational comparative study conducted in a tertiary eye hospital in Kerala. Study duration was 6 months from December 2022 to June 2023. Sample size was 45, 15 in each group. Inclusion criteria, age above 60 years, wet ARMD type 1 and 2 on OCT confirmed by FFA, media clarity, pupillary dilatation and subject cooperation sufficient for fundus photographs. So, the initial parameters we assessed were vision, fundus examination, OCT and FFA. Then we gave 3 loading doses of monthly injections. Then in the follow-up visits, we examined vision, fundus examination and OCT only. That means after every monthly injections, that initial 3 months, then from 3 months from the last injection. Coming to my observations and results, comparison of age is almost comparable. That's around 65 to 66 years for all patients. Coming to comparison of vision, here we can see the Logmark score vision in the y-axis. And for the innovator ranibizumab group, initially the vision was worse than other two groups. But initially, after the first injection, for the innovator ranibizumab group, vision improved comparatively better than the other two. But at the end of all injections, the results were almost comparable. For the foveal thickness also, my innovator ranibizumab group had comparatively increased foveal thickness. So that also increased better with the first injection. But at the end of all 3 injections, all were comparable. Coming to pigment epithelial detachment, the innovator ranibizumab had more pigment epithelial detachment patients, and second, the aflibercept. At the end, we can see coming to the PED flattening effect, the aflibercept group, that is the green color, has almost complete flattening of the flattening effect of the PED. So that worked better for the PED. For the aflibercept worked better. Then comparison of change in SRF, we can see almost comparable for all 3 groups for SRF. And intraretinal fluid also, almost all 3 are comparable. For the biosimilar ranibizumab group, we can see there was an increase in the IRF after the second injection, but at the end of 3 injections, all were almost comparable only. So this is the OCT changes, like we can see the fluid and PED. At the end, the vision also improved and the central foveal thickness also improved. Coming to discussion, innovator ranibizumab is comparable with biosimilar ranibizumab in reference to improvement in vision and foveal thickness. This corresponds with the study by Woos et al. And Ratna D. and Roy K. and Giridhar S. and colleagues study. Innovator ranibizumab is comparable with aflibercept in terms of improvement in visual acuity and foveal thickness. It corresponds with the Gills MC and colleagues study. Biosimilar ranibizumab is comparable with aflibercept in reference to visual outcome and foveal thickness. Comparing the biosimilar ranibizumab and aflibercept group, I didn't get any study. And coming to my limitations, small sample size, short duration of study. So chances of recurrence could not be studied due to the short duration. And innovator ranibizumab group had more edema. The pre-injection status was more edematous. Conclusion, innovator ranibizumab, biosimilar ranibizumab, and aflibercept were comparable in terms of improvement of vision and foveal thickness and all parameters at the end of all injection. So biosimilar can be used instead of innovator injections with reduced financial burden to the patients and also increase the availability of drugs. And no adverse effects noticed in the biosimilar group in our study. Thank you.
Okay, good presentation.
Thanks.
How did you calculate the sample size in your patients?
Sample size are from the parent study using actually the statistician calculated
the formula and told you that these many were enough for statistical
15
significance.
is from each group, sir.
Okay, and how did you choose patients into the 3 groups?
Sir, actually, when the patients with wet RMD came, we counseled the patient for the 3 injections. Actually, that financial part was a bit concern for the all patients, but since they had ESI and claims and all, for most of the patients in my study group had these free injections, like due to their ESI claims and all.
So it was like self-chosen.
Self-chosen injections, sir. Yeah.
They went into different groups. Yes, okay. And can you show me, is the presentation on? Okay, I thought in your graphs,
yes,
the blue line was for the biosimilar.
Biosimilar, sir.
To begin with itself, the parameters were lower, the edema was lower, everything was better in that group as compared to the other groups.
Yes, sir. Actually, in the innovator ranibizumab group, it was comparatively the, yes, sir.
So yes, everywhere you're beginning itself with, them being better than the others.
Sir, the vision and this foveal edema was comparatively worse for the innovator group in my study. That was a limitation, as I told you.